Dear friends, my name is Dr. Ashok Seth, and I'm the chairman of the Fortis Escorts Heart Institute in New Delhi. Great to be with you all. World Heart Day, 29th, just around the corner. And we must remember that this is a day which reminds you about your heart. That is what keeps you going. That's what keeps us all alive. And that's what we got to take care of. So remember, the theme of this World Heart Day is don't miss a beat. And what does that mean? It means that you just got to take care of your heart and understand every sign and every symptom that your heart may be trying to tell you. I have, over the years, had numerous patients who never recognized what their heart was saying to them. I've had businessmen who on travels felt that they had indigestion. They just had some acidity and they said, but I had acidity and because I'd eaten something. And the next day, they had a heart attack during those travels. The people who come to me with breathlessness, saying, मुझे सिर्फ सांस फूलता है. मैं तो सोच रही थी because I was at a height. I was on a holiday, and I kept ignoring it, and then suddenly a heart attack occurs. Palpitations is another common feature. A young guy, techie, who's very intent at work, trying to achieve uh, deadlines, has palpitations which he believes is due to anxiety, and forgets about it till he has a heart attack. Don't miss a beat. That's the message. Listen to your heart. We are the world's capital of heart disease. India, 50% of the heart attacks which occur in the world occur from this region itself. India is growing in the heart attacks in younger. Our heart attacks occur less than 10 years earlier than the West. 50% of our patients who get heart attack or our population get heart attack is aged less than 50 and 25% are aged less than 40. That's huge. It's affecting younger generation more and more. Over the last 15 years, heart attacks in the youth less than 40 has increased by 200%, in the last 20 years by 300%. In fact, if I was to tell you these figures, it is actually true that even I, while talking to you, could get a heart attack. All of us are prone to a heart attack. And heart attack is a true killer. We need to understand that. So we need to understand and take care of our cardiovascular risk factors, and the statistics are frightening, aren't they? Knowing that we all are predisposed to having a heart attack is also to understand that why does the heart attack occur? What are the risk factors? India is also the world's capital for the risk factors of heart attack. Diabetes is maximum in our country, in the world, and continues to increase over the last 20 years. High blood pressure, again a silent killer, most responsible for all cardiovascular diseases, including heart attacks, strokes, and peripheral vascular disease and kidney disease, is also on the rise, and 25% of our population, of our adult population, is affected by high blood pressure, and they don't know it. Diabetes is 20% of our adult population and on the rise. Cigarette smoking is on the rise. Obesity is increasing. And while we'll come to those risk factors and talk about it, we must also understand that it's very important to listen to the heart. There can be whispers. The heart will be whispering that it's not doing well, but the heart will also scream at certain times. As far as the whispers are concerned, what we should be aware about is symptoms of breathlessness, symptoms of indigestion, symptoms of even chest discomfort or uncomfortable feeling while doing a brisk walk, or even at the airport while taking, from a plane right to the gate, or walking with a bit of a luggage in hand. If it brings around any symptoms, even sweating sometimes, ghabrahat can be whispers from a heart. And that's why one says, don't get frightened because you had these symptoms, but do have a checkup done. Do tell it to your doctor. and have the proper investigations done, even if you had an indigestion which didn't respond to acidity tablets. But when the heart screams, it is in terms of a heart attack. Clear-cut symptoms that on walking there's a strict constriction in the chest, that is a heart symptom. Uncomfortable, such an uncomfortable feeling on walking that one's got to slow down and then it gets relief. That's a blockage coming. And a heart attack, of course, is one when one sitting around can have severe chest pain, discomfort, squeezing sensation associated with severe breathlessness going down, and the chest pain goes down the both arms, nausea, vomiting, a sense of doom. That's a heart attack. What does a heart attack therefore mean? In a situation of a heart attack, an artery is getting blocked to 100%. The blood supply to the heart has stopped. And we therefore need, it's a medical emergency, we need to rush to a hospital. And the nearest hospital is the one we go to. And we have two options of treatment. The most and the best treatment option, of course, is if the hospital's got a cath lab and they are able to take you straight from the emergency to the cath lab and through angioplasty and stent, open up the blocked artery. The blood flow restores to the heart immediately, the heart attack gets stopped, and the heart muscle gets saved, and the life gets saved. That's the best treatment option. And of course, in those centers, if you get to a center close by which hasn't got these facilities of opening up the blocked arteries by angioplasty and stent, then immediately a clot dissolving injection is given to open that artery. So keep that in mind. And don't refuse an angioplasty and a stent if the hospital said during a heart attack that that's an immediate and urgent treatment for you. We also have to understand that while we talk about heart disease and heart attacks, women are as prone to heart disease and heart attacks as men. There was an earlier misconception, and certainly 30 years ago, it was clearly felt that women are less prone and get prone only after menopause as the hormones are protective. But it's no more the case. Heart attack and heart disease is the biggest killer in men worldwide, and certainly in India. And so is heart attack in women the biggest killer, and heart disease is the biggest problem in women as well. 6 times more than any cancers, and equivalent to all cumulative cancers of women put together, be it breast cancer, be it uterine cancer, all put together. Heart disease still is higher than that. So women need to be as careful as men, and all the risk factors that we talk about of heart disease also are applicable to women, and women need to take care. And we'll just come to those risk factors. But I also want to emphasize another important point. While we were talking about symptoms and talking about chest discomfort, etc., women during heart attack may not get typical symptoms. In fact, silent heart attacks without any symptoms can occur. And it may be just sweating or breathlessness or nausea and vomiting, may be one of the features of heart attack in women. So women also do not ignore any atypical or minor symptoms, especially if there are risk factors, then do get investigations done. So coming down to understanding risk factors for heart attacks, the start of the important aspect is a family history. If there is a heart attack or a sudden death in the family of parent, mother or father, or brothers, sisters, or first-degree relatives, and sudden death means somebody collapsed and passed away suddenly. If it's parents, men, father age less than 55 and mother age less than 65, and that's what we call at a young age, that increases our own tendency to have heart attacks. Beyond that, of course, is certain other risk factors that we say as silent killers, which is diabetes, sugar, high blood pressure, which again, you don't know that you have it. It can be silent. And of course, raised cholesterol, which can also be silent. But the stuff that we cause on ourselves, which is very important, and the most important perhaps, destruction of our own self and our heart, is cigarette smoking. Is smoking tobacco in its whole form. Not just smoking itself, but tobacco chewing and any form increases our risk of having heart attack by 10 times. Add to that obesity, being overweight, increases our risk. But all these risk factors, when they add up, they don't add up, they multiply. So if they've got a diabetes who becomes a smoker, his risk goes 15 times, and he adds on to that obesity and high cholesterol level goes up to 20 times the risk of having a heart attack. Stress is an important factor. Everybody's stressed out. We need to understand how to deal with stress, but stress is an important factor. And then, of course, we have all others around us. Pollution has been an important risk factor, and of course, more recently, COVID became another important risk factor. So it's up to us to understand how to take care of our risk factors. For example, diet will lower cholesterol and will make us healthy, will get our body weights down. And I told you, obesity and raised cholesterol are one of the risk factors, so have healthy diet. Healthy diet means rich in fruits, rich in vegetables. Avoid refried oils, unsaturated fats as we call it, and more important, trans fats. And trans fats is the oil which is cooked again and again has the highest trans fats. So food which is cooked outside like kachoris, samosas, etc. are highest in trans fats. Stored foods like biscuits, namkeens, etc., which we pick up off the shelves, again are raised highest in cholesterol, and we need to avoid them. Good healthy diet could be Mediterranean diet, but avoid extremes of diet. Fads, numerous fads have come through in diets. Just avoid them. Just be in moderation of everything. Avoid excessive salt. Think good diet and healthy diet is actually medicine for your heart. Exercise. Exercise is the best way to prevent heart disease. 200 minutes of exercise a week, which translates into what? 40 minutes of exercise 5 times a week? Brisk walking. Not gymming, not bodybuilding. Just aerobic exercise, which means brisk walking, cycling, swimming, can decrease our risk of heart attacks by 25%. That's more than a tablet any medicine can do. In a way, exercise is easy to do, is inexpensive, lowers our cholesterol, gets rid of weight. It also lowers blood sugar levels and controls diabetes, controls high blood pressure also, makes us feel positive, helps us to give up smoking because we want to be healthier, and also takes away our stress because we feel positive. In fact, it takes care of most of the risk factors for heart disease, and therefore exercise, exercise, exercise. Make it a part of your life, make it a part of your habit. We talked about stress, and stress exists in everybody's life. But we also therefore say that it is how do you handle stress. Take time out for handling stress, learn stress management, and it's simple. Spend time with family, have a hobby, have a pet, travel out regularly, make sure you take time off from work. There are numerous ways to absorb stress. Yoga, spirituality, all decrease stress, and therefore take care of your stress, sleep well. Sleep plays a very important risk factor, is an important risk factor. And people who have bad nights are always under stress and also have increased tendency for heart attacks. We've talked about high blood pressure anyway. We talked about diabetes. And we talked about the fact that absolutely no smoking at all. And yes, another risk factor is excess alcohol intake. Alcohol occasionally, in moderation, 1 or 2 pegs occasionally and socially are fine. But if you take excess alcohol and drink every day, or have binge drinking, even if you say I drink once a week, but I drink 8 drinks, that's bad. That's bad for the heart. And we know that that's a killer. So avoid alcohol. But more importantly, I'd say, control and prevention of heart attacks in our hand. We need to know our risk factors. We talk about numerous policies from the government and actually rely on everybody else to say, humko heart disease se bachao. But that's not the case. We ourselves can decrease our risk of heart attacks, and every Indian in this country needs to know his own risk factors and be able to handle them. For example, I said diabetes and high blood pressure are silent killers. It just takes a visit to a general practitioner to get a blood sugar done, a blood cholesterol level done, and finally, a BP check. 3 important risk factors are just a cheap checkup from a general practitioner, isn't it? Obesity and smoking and being overweight is in our hands. Stress management is in our hands. So if we know our risk factors and our numbers, we're there, aren't we? So why aren't we talking about it? If we have to actually tell you that what is it? We need to control our blood pressure, make sure that it's always less than 130, closer to 120 over 80, and always less than 130 over 90. That's all we need to do. Make sure that our sugars are well. Hemoglobin A1C is less than 6 all the time. If you don't even get to a pre-diabetes state, hemoglobin A1C is less than 6. Make sure that we actually understand those figures. Our BMI, our weights should be in the normal ranges, 18 to 24. Don't be overweight. Just understand these numbers. What about cholesterols? LDL, good cholesterol, HDL above a 40. Bad cholesterol, LDL, less than 100. If there's a family history, even lesser. We need to understand our own numbers and be able to identify and treat it. A final thought comes to my mind, and that is very important to understand, that we have seen recently visuals on the television, on the visual media, around someone who's been exercising and just after exercise collapses and dies. These are very disturbing visuals. Someone who's just been in a very vigorous dance and collapses and is no more. And this has happened to celebrities, but it's also happened to common men. Having a Garba dance and suddenly someone collapses, or a dance on the stage and collapses and is no more. Why is that happening? It's important to understand that these individuals may have had risk factors but did not have any checkups done. And therefore, a checkup becomes very important, especially for those who go into extreme exercises, vigorous exercises, gymming, bodybuilding, and extreme sports like long distance cycling, marathon running, etc. So but checkup is important for all Indians in this country to know the risk factors. And I would say this checkup should start at the age of 20. And then those who have certain risk factors should have a more regular checkup, but otherwise 5 yearly checkups should happen for every individual. Those who've got a family history should have their checkups and even blood tests and blood cholesterol done by the age of 10 to 15. I'm going to emphasize one more point. Those disturbing visuals I talked about where people collapse suddenly and die, those lives could have been saved. And those lives could have been saved by the very person who actually took that video. Everyone in this country needs to know basic resuscitation. It is very important to learn CPR, cardiopulmonary resuscitation, and basic CPR is so easily done that I or you could save a life of our own relative who would collapse at home, can collapse at home. In fact, I would even go to the extent of saying every relative, near to close degree relatives of every heart patient should know basic life CPR. Because that person with heart disease could have a collapse at any time. And then it would be us saving that life right in the house. These collapses can occur at any place. It could be in the mall, it could be at home, it could be at a function. CPR is easy to learn. If you just go on to Google, you suddenly realize that every one of us can do a CPR. And it's been well known across the world that there are cities where every citizen knows CPR, and that saves lives of more than 50% people who collapse in the community. So CPR is important for all of us. All of us not just need to watch those lives going away, but need to be able to save a life. All of us do need to say that. So a final thought about our heart. This is our engine. we must remember that it keeps us alive. We must also understand that it beats 100,000 times a day for days after day, for years after year, keeping us alive and going. It is the most important engine that we have ever seen created by God. And if we don't look after our engine, we will stop. And if we stop, we are not there. Think of our own near and dear ones. Think of our families. Think of the society. Think of how, if we don't care of our hearts, what would happen to us, to our family, to our near and dear ones about it. Our present and future depends upon taking care of heart. And that is why on this World Heart Day, pledge that you're not going to miss a beat. You're not going to miss a beat. You're going to look after your heart. You'll understand it. Take care of your risk factors and be sure that we protect and preserve our heart so that we can live longer, healthier, and better for all. And not just that, on this day, pledge that you're going to have checkups done regularly and regularly. On this day, pledge that you will learn CPR and save lives of others who have heart disease. On this day, also pledge the most important thing, that you will spread this message around numerous other people so that everyone realizes that the health of our heart is in our hands. And not just in our hands, I'll say, in our feet. Exercise regularly. Make it a part of your life. Look after yourselves. Stay healthy and stay well. So all I can say finally is goodbye to you all. We have a responsibility. Let's take care of our hearts together. Let's not miss even a single beat.